So this is a great slide. This is one of my favorite slides in the presentation, besides some of the other interesting stuff later on. Dr. Armstrong does a fantastic job with his crew at USC. And what he did, he took the mortality rates with patients with DFU and compared it to cancer. Okay, in 2020, he published this. What's really cool about this, you guys, and not so cool, the 5-year mortality rate with patients with Charcot, those are the patients that have the really, really bad, incredibly bad feet that break down a great percent of the time. And DFU was 29 and 30.5%. Minor and major amputations were 46.2% and 56.6%. Okay. This is compared to breast cancer, which is 9%, 80% for lung cancer, and the 5-year pooled mortality for all reported cancer was 31%. Okay, that's astounding. Now let's talk about some of the costs. All right, cost in general for diabetes in general is 237 billion. That's it with a B, billion in 2017. That's 4 years ago almost, right? Up to a third of direct costs care of diabetes attributed lower extremity, which equates to about 78 billion. 80 billion costs for cancer alone in 2015. So the lower extremity is 78, just the lower extremity, 78 billion. Cancer, 2015 was 80 billion, okay? You know, we have to stop this cascade. We have to stop this resulting in amputations. We have to stop resulting of American people and people throughout the world passing away from this mortality. Next slide, please. So current treatment paradigm, 49% recurrence rate in the first year, 68% recurrence rate within 5 years. Okay, let's break this down a little bit, okay? This is depressing in terms of we work so hard, okay? How many can you think of? You've got a patient that comes in, they're nervous, or they've got a callus that we debride and we take it down. What's underneath, okay? You've got a pus pocket, you have an ulceration now, right? Okay, it's certainly not a unique situation. It reopens, okay? In fact, in the first year, 49% of people reopen within the first year. 68% within 5 years. Because I tell patients, hey, listen, we're not done yet, okay? We also have to address the biomechanical issues that are addressing this. And we can touch upon that a little bit later on in terms of pressure points, et cetera, and how we alert the patients, hey, you got to move. You're spending too much time on that area. You're gonna end up with an ulceration. By year 10, almost all those patients have one additional ulceration of the 68%. It's amazing, okay? So we have to change kind of our way of telling patients, say, listen, you're healed. No, you're not healed. You're just in remission, okay? What I mean by that is biomechanically, you're still gonna have the problems that we need to do this. So we need to off-weight that area. We need to identify the pressure places that we need to take pressure off of that area, okay? Just because you heal now and you dodge that bullet doesn't mean within a year, I mean, these statistics clearly state that it's gonna happen. It could happen, okay? So we need to change your attitude. We need to change the way that you actually view your ulceration and be more proactive itself, okay? Fortunately, Center for Medicaid Service or Medicare Services, excuse me, has identified the fact that this is a distinct problem, that it's not healed, that it's in remission, and have acted accordingly to help us in this battle.